So what is the plan of action? Flatten the curve, flatten the curve, flatten the curve. Reduce the spread. How do you reduce the spread? Testing, isolate the positives, but frankly, more move towards density reduction. Just reduce the number of people in contact. Second, increase the current hospital capacity. Hospitals currently have 53,000 beds. How do you get more beds in your hospital? Third, identify new hospital beds. How do we increase the supply of hospital beds? Well, that's very hard when you're only talking about 45 days. So what? This is New York. There's nothing we can't do. And do all three of those things simultaneously, which is what we're doing. On identifying new hospital beds, we met yesterday with all the hospital administrators. I spoke to them. I said, we have to increase the number of beds you have in your hospital. We're going to waive all the Department of Health regulations for the time being. Department of Health says how many beds you can have in a room, the space between the beds, all good regulations, by the way. But waive them so we can get more beds into existing hospitals. We also have to make sure those beds are staffed. So more staff, reserve staff. We're reaching out to retired nurses, retired doctors, nursing schools, medical schools to build up a reserve capacity. Because also you have to anticipate that some hospital workers will get sick during this. So you need a reserve capacity for that basis. How do you create new hospital beds? This is probably the greatest challenge. First, convert facilities and take people who are in current hospital beds and move them into a converted facility who need a lower level of care. Second, the federal partnership, which is key. And as we discussed yesterday, the state cannot do this on its own. We don't have the capacity, we don't have a workforce. We're very ambitious, we're very aggressive, but the most important thing in life to know is to know what you cannot do. Know your limitations. We can't build new hospitals in 45 days. The federal government can be extremely helpful here, and we need the federal government's help. I had a conversation with the president yesterday. It was an open and honest conversation. We've always had a very good dialogue. Even when we don't agree, we've always had a very good dialogue. But the president and I agreed yesterday, look, we're fighting the same war, and this is a war. And we're in the same trench. And I have your back, you have my back, and we're going to do everything we can for the people of the state of New York. And the president agreed to that, and I agreed to that, and his actions demonstrate that he is doing that. I've had a number of conversations with White House staff who are working on this. I had a conversation with the Secretary of the Army. The president sent the Army Corps of Engineers here this afternoon. I'll be meeting with them this afternoon. I spoke to the president this morning about specific actions the president is going to take. I can tell you he is fully engaged on trying to help New York. He's being very creative and very energetic, and I thank him for his partnership. As I said, the Secretary of Defense, they can be very helpful. The Army Corps of Engineers can be very helpful. And FEMA can be very helpful. And we're speaking with all of them, and we're working with all of them as we speak, and we have been around the clock and all through the night. So if Commissioner Zucker looks a little tired today, that's why. Young people have no stamina, I like to say. The president I spoke to this morning, he's going to be making arrangements to send up this hospital ship, which is called the U.S. Comfort. It has about 1,000 rooms on it. It has operating rooms. And the president is going to dispatch the Comfort to us. It will be in New York City Harbor. This will be, it's an extraordinary step, obviously, but it's literally a floating hospital, which will add capacity, and the president said that he would dispatch that immediately. The president also spoke about the mobile hospitals that the federal government has and where we could set up mobile hospitals where they come in with a mobile hospital that has a capacity of 200 people, 250 people. I told the president that we would do everything we need to do to expedite siting of those facilities, and we're talking about a couple of locations now, but that is also specific and concrete help and something that we can get done within the 45 days. At the same time, as I said, we're proceeding on all these tracks simultaneously. Density reduction, we have taken a number of dramatic steps, but I think they are necessary steps. You've seen the curve. We can't handle the number of cases in the healthcare system at that current rate of spread. We have to get it down. We've taken dramatic steps. I've said, and I'm going to repeat today, I'm asking all businesses voluntarily, if it is at all possible, work from home and have your people work from home. We also have already announced a mandatory requirement that all schools are closed statewide, a mandatory requirement that no more than 50% of any government's employees can show up for work. Essential personnel, yes, but no more than 50% of city, local governments. We also have a mandatory requirement, as you know, of a tri-state agreement. Pleased to announce that Pennsylvania is going to be joining our state coalition, and that's very exciting because none of these measures work unless you have a large enough geographic basis. It makes no sense for a county to try to put its own rule into effect or a city to put its own rule into effect because people will just move. If I can't go to a bar in Queens, I'll drive to Nassau and go to a bar. If I can't go to a restaurant in Albany, I'll drive to Schenectady. So the geographic footprint, by definition, is essential for these to work. And frankly, even if I come up with a rule for the entire state, people will drive to New Jersey or Connecticut or Pennsylvania. And that's why the first ever we have this statewide coalition. And I want to thank Connecticut Governor Ned Lamont and New Jersey Governor Phil Murphy very much, and Pennsylvania Governor Tom Wolf, who've been great colleagues, and I thank them very much. Again, I'm asking all businesses to work from home, but today we are announcing a mandatory statewide requirement that no business can have more than 50% of their workforce report to work outside of their home. No more than 50% of the workforce can report for work outside of the home. That is a mandatory requirement. I'm going to do that by executive order, and that is statewide. That will exempt essential services, meaning food delivery, pharmacies, health care, shipping, supplies, etc. Society has to function. People stay at home. People still need to be able to order food, etc. They need to be able to shop. So you have to keep those essential services running.